Today I'm going to be talking about how to collect more per patient or how to do more treatment per patient over just the first year that they're with you. This is something that I've been diving into and I've been looking at. A couple things that I've been reviewing is number one, what is the average case acceptance for 2025 for digital new patients? And what is the average case acceptance for patient referrals over the last 12 months? And what I've seen is most offices are ranging for the digital new patients somewhere between $1,000 and $1,500 per patient for that year, digital patients. So for the full 12 months. And then for the patient referrals, usually they're somewhere between $1,500 and $2,000. So this is really useful information because you can actually get that up, because we all know that the patients actually need more treatment than is actually given right in that time frame when they first become a new patient and the following months. But there's a lot of things that prevent them from doing the treatment with you. So we're going to talk about that, how to get that number up. Now, if you want a step by step on how an office actually went from doing $1,500 to $3,000 a year in average collections of each new patient, I didn't get those numbers wrong. Those are accurate numbers. I actually have that. If you want to comment down below, I can give that to you. And it's a doctor that we work with, and she does a great job of sharing that. But I'm just going to give you some practical tips that will help you with your practice accept more treatment. So obviously you got to answer the phones, right? The more you answer the phones, and if you're not answering the phones, you're missing phone calls, I highly recommend that you use our AI agent. It's right down below. It's only $299 a month. It converts as well and schedules as well as patients. So that's the first step. You got to close that gap. Once you have that gap closed, then you need to work on your phone conversion. Your phone conversion, typical office, is converting about 60% of new patients. You got to get that up. Got to get that up into the 70s, 80s, even beyond that. Okay. And that goes, the only way to do that is listening to the phone calls and doing the training and making sure that the team is following the training that you give them. Okay. And we have that training. If you want that, comment down below. All right. So assuming that you have those things done, the next thing that you want to look at is how fast you're getting the patients in. Average time to appointment right now is over 2 weeks long. So patients are waiting over, I'm sorry, I said 2 weeks, 3 weeks. Patients are waiting 21 days to get into the dental office. That messes everything up. That messes your show rate up. That messes everything up. So you got to change that. If you want to accept more treatment per new patient, you got to fix all those things first. Now, we haven't even got to the office side of it yet, right? This is all pre-office. So what's the next step? The next step is making sure that you are getting people who are actually coming in, and then that you're doing the treatment as fast as possible once they get in. This is crucial. If you push them out too far and make them wait, then you're losing a large percentage of your treatment. I actually track this. So average treatment done on first new patient visit. And what I have found is this. You want to get that number as high as possible, but if you break over like $800 to $1,000, that means you probably don't have enough new patients. So you're doing all the work on the patients because there's nothing else to do. And if that average treatment done on first visit drops below like 500, that means you're kicking too much treatment out. So it needs to flow. A healthy number that I've seen is somewhere between like above 500 and below 1,000. And so look at that number. That's really, really important. This is something we track for every single one of our clients. Now, once you have that, the other thing you want to make sure that you have is that you use patient financing. Now, Cherry is a sponsor. The link's right down below. If you want special pricing for them, I think they're the best. A lot of our clients use them. They're amazing. However, I don't care who you use as long as you're using them. Now, here's what everybody says. Yeah, we use patient financing. That's not what I'm talking about. You need to use patient financing in a way for every single patient. Meaning, when I go to a website and they use some kind of customer financing, they always offer it up front. Do you want to use financing? Always up front. Did you know it's only this much a month if you use financing? And what happens is more people end up saying yes. A lot more people end up saying yes, and they say yes to more because they can afford it. Dentistry has gotten really, really expensive, and patients are making less money in relationship to like the inflation of cost and goods. And so you have to make it easier for them to say yes. And if you, all you have to do is you have to use Cherry or another patient financing, and you lead with the monthly payments. Hey, we have patient financing. This treatment, we can do it for $100 a month or $200 a month, whatever. And this is what you need. Blah blah blah. The other beautiful thing about that is insurance becomes a byproduct, bystander. Like insurance doesn't matter if the focus is on a monthly payment. It's just like whatever the insurance covers, it covers. It doesn't. You're not bickering over pennies on or dollars on the insurance. You are simply looking at a monthly payment, and it literally eliminates the insurance problem. So that is how you get more production. And if you want any of those trainings, those courses, anything like that, I have them all for you. We have a whole suite of training around how to use Cherry properly, the different ways that you can use it, different ways you can grow with it. So hopefully that's helpful. And thank you so much for tuning in. I hope you guys have a great day.